Coronavirus cases in the United Kingdom are rising for the first time since lockdown, fueling fears of a second wave of the virus. The number of infections is doubling every week as the government brings in new restrictions to stem the spread.
We're at a crossroads, a really critical phase in the pandemic.
We're seeing a reduction in some of the freedoms we've got, and that is really tough, particularly on young people.
We've had weeks of warning, but cases have climbed. And now Birmingham is under lockdown.
From next Tuesday, there will be a ban on household mixing. So if you live in one of those three boroughs, you cannot visit another household, and indeed you cannot host people from anywhere into your household.
The impact is huge, affecting Birmingham, the suburbs Solihull and Sandwell, home to more than 1.6 million people. Confirmed coronavirus cases in Birmingham have more than doubled in the past week to 78 cases per 100,000 people.
If you don't follow these rules that you've just heard loads about already, then it will come and visit your family. You will know a family or a family member or someone else very close very shortly that will die. And I'm sorry if I'm blunt, but I think we need to be blunt.
But, however blunt, it's still not getting through.
It ain't going to make no difference, because everybody's getting together around here. There's no restrictions around here. If you walk down this street now, you're going to each shop, no one's wearing masks. No one's bothered.
Major hospitals in Birmingham are already back on high alert because of the rising number of COVID-19 cases. A number of schools have sent entire year groups home because some students have tested positive. This was meant to be the time things were getting back to normal, but it feels like we're going back into another crisis.
And enforcement is harder than ever.
These are not popular things. They're not rules everybody kind of is wholly behind. People grudgingly now accepting we need to follow the rules, and that can create some resistance for us. Of course, finding the time to make sure we do our normal role and this work is important, so it requires us to prioritise, and that's why I'm being very clear we're going to be more targeted this time.
And for people like Margaret with underlying health conditions, there is a sense of frustration and fear.
I can't be angry because some people are not educated enough to understand what this thing really is.
What do you think people need to hear then?
They're so hard-headed. If you even talk to them, they don't listen.
Watch closely what happens here. Because if Birmingham is at a dangerous crossroads, other towns and cities may not be far behind.